Hi guys, Happy New Year! I wanted to, I'm sorry, okay, let's just talk about what happened and why I'm here. I'm in my pantry and I'm going to grab my Isotonix, and I look at my Isochrome and my Resveratrol, and one of the things that happened was I was like, wait a minute, I wonder how many people know about the magic of Resveratrol and Isochrome. So I said, I know, I'm going to go live today, and it's so timely because it's the new year. So Happy New Year, everybody. Let's talk about those patients that are walking into your practice and they want to get their blood sugars under control. They want to lose some weight. They are looking to have a better, what do we always say? New year, new you? I don't know if we say that. Either way, we have a lot of people willing to make changes when they come in at the beginning of the year, right? And so I'm looking in my pantry and I see these two ingredients, and it brings me back to what I used to do with TLS. And that's just, and I say used to do because it was something I implemented years ago, and now it's just a habit with TLS, which is when that individual comes to a TLS weight loss class, right? And I'm going to help them lose weight. I need to know, as we all do, what did you do in the past? What has worked for you in the past? What are you willing to commit to today? And years ago, I revealed this very unique demographic of individuals, and sometimes it was a woman and sometimes it was a man, where they were athletic in their younger years. And not just like, I'm not talking about Pee Wee football, right? Like, these were people that were collegiate athletes. These were patients that got out of high school, did very well in sports, were able to play sports in college, and then they graduated from college, and we all had to get real lives, and we got jobs, and we got families, and we did whatever it is that we needed to do, or those adults do, adulting, right? And they stopped playing sports. And so they had this muscle memory. They had this endurance and physical strength from previous years, but they had this extra padding, as they would always say, right? I have muscles underneath here. I used to be muscular. I still have the strength, but I've got this extra insulation in these areas, right? It wasn't always like this. And they would say, but I really struggle to lose weight. And what I found with these individuals, that a certain combination of nutrients worked exceptionally well. Why? Because in the previously muscled individual, or the individual that is still strong and muscled, but it's under a padding of insulation, they still have some great mitochondrial demand, which means that they've got these muscle fibrils that work really well, right? They're just not working as efficiently as they once did. But they still have a lot of mitochondrial demand and a lot of mitochondrial, I'll call it load, right? So they're actually quite good at that cellular energy transport. They just need help burning off the excess fat. And it kind of, to get to that anabolic threshold for them, the under-muscled person, or the person that's marginally muscled or adequately muscled but not muscled, right? They only need to get here to get that thermogenesis going. But you've got that person with that underlying layer of muscle, that previously muscled, still energetically strong, still mitochondrial well, right? To get past their threshold, their anabolic threshold, and really grow something, you need to get up here, right? So what am I saying? We're not talking about the patient that walks in that is either submuscled or they are marginally muscled, or we're going to say adequately muscled, right? They're not under muscled, but they're not great either, right? What does toned mean? Anyway, ask a toned person or ask a muscle person. They'll be like, whatever. The point here is that what it takes to take them from here, it's always easier to gain on a smaller number, right? To here, they start to see benefit. But when you've got that same person, but now they're a muscled individual, right? Their baseline is here. This little bit of a bump doesn't do it for them. And that's kind of what we see in that first few weeks, right? that little bit of a bump. This person doesn't see the same benefit from detox. This person doesn't see the same benefit from cleaning up their diet, right? Because they have muscle where that anabolic threshold needs to get to here, right? We need to bump them up for them to see the benefits. Da-da-da-da! That is where nutraMetrix Isochrome and nutraMetrix Resveratrol come into play. These two together support that mitochondrial anabolic bump. They already have mitochondrial cells, right? They already have this great reservoir for the mitochondria because they're more muscled. But now we need to feed those muscles. Now we need to do something about those muscles. And that's where Resveratrol, that's where Isochrome come into play. Now you may ask, can I just give them coenzyme Q10? No, doctor, you may not. In fact, it is the combination of coenzyme Q10 and carnitine together that make Isochrome what it is, right? But also give it the solution that we need for this mitochondrial health. Resveratrol comes in and allows the cell, the mitochondria, everything to work on lower number of calories but more efficiently. Resveratrol comes in and kind of shunts or shuttles energy in a different way, simply because it pushes the body through an NAD pathway, an energy pathway, right? One that's going to create better energy production. Is then the bump that we're going to get from the coenzyme Q10 and the carnitine that are in Isochrome that are going to create the substrate for that better energy. And what I'm referring to is a better anabolic window. We need to get up and we need to bump up that anabolic window. That's what that's going to do. What is the next thing that happens? So what have I said? Patient walks in, they're more than adequately muscled. In fact, they have a history of being well muscled or being athletic, which means they're not losing weight as easily as that person where a little bit of a bump in their anabolic window helps them. That's the first thing. We need to treat these people differently. More protein, right? A better approach to what it's going to take for exercise. They're going to need to be under load, under heavier weight. This isn't a volume issue, right? This is a weight issue, so we need to put these people under more weight or under more load when they work out, and we need to feed their muscle fibrils better. And that's where the Isochrome comes in, and that's where the Resveratrol comes in. But there's still going to be this issue, whether it's an aged person or just a person that's got those extra insulation of fat, right, that they're trying to shed. They may have endurance issues. Remember what I said at the beginning. These people come in with a history of being physically fit, and they were able to maintain what? Their strength. But they may not have maintained their metabolic endurance or cardiometabolic endurance. That has started to decline with age and with being overly fat or having extra insulation. And that's where astaxanthin comes in. Astaxanthin is an incredible carotenoid. It's actually in the carotenoid family. It's referred to as a xanthophil. But it is in fact this xanthophil that accounts for endurance, metabolic endurance. In fact, a large number of clinical studies have been done on athleticism, marathon activity, and better health in runners, including recovery for individuals that use astaxanthin. But it's not just any astaxanthin. In fact, those clinical studies were done on astaxanthin, and that's why we use in the nutraMetrix Prime astaxanthin cardio vision and vitality formula astaxanthin 6 milligrams for you, and that's going to be one of those things that's going to take that individual. We're going to increase their anabolic window with Isochrome and Resveratrol, but we're going to allow them to capture that endurance and that resilience, but also recovery by giving them the prime astaxanthin. This is my unique take, maybe not so unique, but I'm the one that told you about it, right? This is going to be my unique take on that individual that has a history of being athletic, comes to you for TLS Select and is not losing weight, or tells you that they tried in the past to lose weight and they don't lose weight as fast as other people, I want you to ask yourself, were you an athlete in younger years, in your 20s, in, not just, I'm not, like I said, not peewee softball or anything like that. Were you competitively athletic in your collegiate years? If that's the case, I want you guys to think adding to their TLS whey protein, whether it's the nutrition shake or the clean hormone-free protein, whey protein in the packets, adding to their CLA for that stubborn belly fat and areas of extra fat deposition, whether it's green coffee or just talking to them about getting a good night's sleep, because that's hugely beneficial in losing weight. I want you to also think about talking to them about making sure that they're getting resveratrol, isochrome, and astaxanthin. In fact, in these individuals, in particular, if they say, I don't really identify with overeating, I don't really identify with stress, this is where we're going to take them out of the core, out of the ACTS, right? I'm still going to tell you that athletes respond very well to CLA, but now what we're going to do is we're going to give them this package instead. Again, the whole idea is bumping that anabolic window for the individual that is well muscled, but a little bit padded. Okay, you guys, that is my, I don't know, I would call it resolution, topic, but listen, this stuff will help you no matter what time of the year it is. Just ask that question about their athleticism. Okay, talk later.